Hello, and welcome to today's Full Stack Medicine interview. Today, I have the pleasure of being joined by Dr. Manuel Pereira Herrera and Dr. Adriana Fitzsimmons. They recently published a case report on a patient who experienced a distressing near-death experience following a cardiac arrest, and today they're here to tell us some more about this work. Dr. Pereira Herrera and Dr. Fitzsimmons, thanks very much for coming on to join us today. Looking forward to hearing more about this work. So to start off, would you like to both introduce yourselves and share what you do?
Sure. I'm Dr. Adriana Fitzsimmons, and I'm the Consultation Liaison Director for Psychiatry at Jersey Shore University Medical Center.
Hi, I'm Manuel Pereira Herrera. I'm one of the psychiatry residents at Jersey Shore Medical Center, and I work with Dr. Fitzsimmons for this case.
Wonderful. Looking forward to hearing more about it today. So I'd like to tell us about this publication and what inspired you to write a case report.
Sure. So this was an interesting case of a patient that reported a near-death experience. He suffered cardiac arrest in the ICU, and what drove us to, and particularly me when I saw this case, is that both of my parents had experienced near-death experiences, and I've always been thinking about that. I've been reading a lot about that, and I was looking to see when a patient would come up that could potentially have this. I had asked several patients before in different rotations, and no one seemed to remember. But then when I asked this patient, he told us quite an interesting story. So that's what prompted the report. And I spoke with Dr. Fitzsimmons about this, and she was very interested too. She agreed with that this could be something that might interest the general medical community. So we went ahead and wrote the report.
That's great. So in your publication, in summary, you detail a patient who experienced a highly distressing near-death experience following a cardiac arrest. So how common are these NDEs, and why is it critical for medical professionals to recognize that they're a potential clinical reality in any patient who is successfully resuscitated from cardiac arrest?
Yeah, so in any critically ill patient, between 10 to 20% may report a near-death experience. The average is about 17%. And in cardiac arrest survivors in particular, it's almost 40% of people that will have these experiences. When asked, and however, they may not voluntarily disclose this. In people that do have any brush with death, almost half of them, almost 40% of them, will report acute stress symptoms within a month or so of the experience, right? And almost half of the people that do have enough acute stress symptoms that cause an impairment in their functioning go on to develop post-traumatic stress disorder, which is a more severe, prolonged, persistent form of acute stress disorder, right? And post-traumatic stress disorder is associated with increased mortality, between 30 and 40% all-cause mortality. It's associated with higher rates of suicide. It's associated with higher rates of depression. So it's something that we would want to keep from happening in these patients. So given that patients that had a near-death experience may not report it, given that they may go on to develop these complications just from the experience itself, we felt it important to at least bring up an awareness of the subject. And it's nothing new. I mean, there are more than 4 decades of research on near-death experiences, and yet the topic is not widely talked about. Those are the drivers that we felt were important to consider.
we always screen for, things like anxiety, depression, acute stress disorder, post-traumatic stress disorder. So, we are just screening in general, of course, for all the patients that we do see. But as Dr. Herrera says, that sort of awareness that this exists and that patients are suffering with this, and that it really, may entail kind of a further line of questioning, and evaluation, so definitely a need for more awareness,
Mhm.
in the medical community.
Definitely. It's great that you're able to publish this report and to contribute to raising that awareness. So the patient in your study had significant anxiety and some very distressing symptoms after his near-death experience. Could you elaborate on the relationship between a negative NDE and the development of acute stress disorder? How can the symptoms of such an experience manifest?
Yeah, so in general, most near-death experiences tend to be pleasant. And I'm sure, you know, you probably have seen movies or documentaries about this. However, 1 in 5 tend to be distressing. And of those that have a distressing near-death experience, again, almost like 30%, a little bit more, can develop acute stress disorder. And some of the symptoms are fear of what can happen, hypervigilance, so the patient is constantly aware of what's going on. They may present insomnia, they may present irritability. They may have flashbacks, repeated flashbacks of what happened. They may try to avoid talking about it, avoid thinking about it. In this particular case, the patient felt that the entities that he saw, the people that he saw in his near death state, in his out of body state, were going to come after him and were going to take him. And he was very afraid. He didn't want to sleep for fear that they would come and get him. And this was going on for more than 3 days now. For about 3 days when we saw him, and he was not sleeping, he was very anxious, he was distressed, he kept having flashbacks. So all these things that's more than just anxiety, right? It's something more severe.
Absolutely. And one of the most striking aspects of the case was the rapid amelioration of the patient's symptoms once the NDE was addressed. So, what specific steps can a physician take to normalize this experience for a patient and change the trajectory of recovery?
So there has been some research about this, and the recommendation number one is normalizing the experience. So um, letting the person know that this happens and it's quite common. Even there may be a lot of fear about this, fear of ridicule, fear of being pathologized, fear of the people just not accepting or believing what he's saying or the patient is saying. So normalizing the experience is number one. Um, Providing reassurance, explaining what is known up to this point about the near-death experience, sharing um, the findings from the people that have studied this, which are quite a lot, especially at the University of Virginia. Dr. Grace and this group, they've been studying this. There have been large-scale studies about near-death experiences here in the New York area too, the AWARE study, just sharing that, providing empathic support, uh, and that tends to help the person to accept what happened, to integrate the conflicting views that they may have seen in their out-of-body state from what they believed, and try to move on from what happened, knowing that um, their life will continue, their life will likely change. In most cases, it does change. um, and that they can move on to continue their lives, in a better way.
If we can, validate their experience, you know, um, let them know we're taking it seriously, that we want to hear about it and we believe them, and and that kind of a thing. I think it creates a very supportive environment, for them to feel more comfortable with reporting, their own experience.
Absolutely. I'm sure that feeling validated goes a very long way. And along those lines, I'm sure many providers may hesitate to bring up near-death experiences for fear of overstepping or pathologizing the patient. So based on your findings and your research, what is your recommendation for the timing and manner of addressing subjective experiences of those who have had a cardiac arrest?
So the sooner that the providers can find out that the person had an experience and is having symptoms, the better. The faster that they will improve. The longer that one waits and finds this out, the higher the chance that it may progress to something more serious. So as soon as possible, like there's no real reason why we shouldn't ask anyone that had a cardiac arrest whether they had this experience or not. We know that from the research, up to almost 30% or more will have it. So that could be the first step, right? Addressing it as soon as possible, just asking, did you have this? This is something that commonly happens to a lot of people that go through this. Um,
And follow-up questions, if patients are reporting through our routine screening and evaluation, regarding symptoms of anxiety or insomnia, and those kinds of things, but just follow-up questions, related to that if they are reporting anxiety or reporting fears or aren't sleeping well, that we follow that up, with more questions, along those lines, so we can elicit, the more details, to get a sense of whether they've had this experience.
Absolutely. Awesome. So as we wrap up today, what would you say is your main takeaway that you would like readers to remember from your case report?
I it would be great if providers would just ask, would keep it in mind, so that they don't miss patients that may have this and are afraid of telling anyone. Um, that would be the main takeaway from this. Just greater awareness.
And if we, feel that it's possible that they had, some kind of experience, uh, and even if we're not sure, that regardless, we treat their symptoms, and we refer them also, even, once they are discharged, to, outpatient follow-up to get the support and treatment that they need.
Wonderful. Well, thank you very much, Dr. Pereira Herrera and Dr. Fitzsimmons, for coming on today to tell us more about this work. It's wonderful to hear about your case report, and we appreciate your taking the time to share about it.
Thank you so much for the invitation and your interest.
Thank you.